Well, the White House announcing it has secured enough COVID-19 doses to vaccinate children ages 5 to 11.
So those doses could get to doctors' offices and pharmacies within, the next few weeks or so.
Joining us this morning to talk about what parents need to know ahead of this is Dr. Umair Shah, Washington Secretary of Health. Dr. Shah, good morning.
Hey, good morning. Great to see you guys. Thanks for having me.
Yeah, and this is great news, too. How many doses will our state receive from the federal government in order to vaccinate all those kids 5 to 11 years old?
Yeah, so that's been interesting that we've been continue to work with the federal government about what that allocation is going to be looking like for Washington. Some moving numbers, but we do feel confident that we're going to have enough vaccine initially to start. Now, obviously, one of the challenges is just going to be how many parents are going to take their kids to get vaccinated. We want to make sure we get as many parents to get their 5 to 11-year-olds vaccinated.
So I guess on that note, do we know how the shots will be allocated at all? I mean, you remember, right, when the vaccines came out for adults, it was impossible to get them, and we were grouping in people. What do we know about that so far?
Yeah, well, this should be different than it was earlier in the process. Remember, earlier, we just wasn't enough supply out there. The federal government has said that there is going to be ample amount of supply. They've said 28 million 5 to 11-year-olds across the country. There should be about 15 million that are going to be going in the first week or so out to states across the country. So they're saying there's enough. Now, remember, it's also challenging because we got to figure out how to just measure the demand. But I think one of the things, and this is, I think, the message to the parents, is that you don't have to rush in that first day. It's that, first period of time, the week or so, we want to make sure that people, get their appointments and get their kids vaccinated. Don't wait, but certainly don't have to rush that first day.
And you know as well as anybody that there's a lot of vaccination hesitancy. We just saw all the numbers from state workers that were, out of a job suddenly because they refused to get vaccinated. Is there going to be any kind of an education process for parents that actually want to hear your message?
Yeah, absolutely. First of all, I think we have to remember this, the vast majority of people are actually getting vaccinated. So I think sometimes we forget that. But I think the other thing is that, look, I'm a parent. My wife and I both have, kids who are going to be in that 5 to 11-year-old category. Our 12-year-old just got vaccinated, fully vaccinated now. And so, we know that there are questions, but at the same time, we also know that once people go to people they trust, like their healthcare provider or others who have good information, they actually tend to get vaccinated. And I think that's the key message. Go to someone you trust, healthcare providers especially, ask your doctor and get the right vaccine for your child. I think that's the key message. Now, we're working with schools, pediatricians, mobile teams, doing all sorts of efforts alongside our local health departments. But I think the key is the parents to just make sure that they don't hesitate in getting their questions answered and certainly getting their kids vaccinated.
I mean, I think the goal and the hope is, with every vaccine that gets, put into an arm, we're hoping that we can return to life before the pandemic. Could this be it, do you think, now that kids can finally get this shot?
It's going to get us closer, right? Every shot, every arm, every person is one step closer to ending this pandemic. And that's why we're so focused on vaccines. We've had almost 9.5 million doses of vaccines administered across the state of Washington. We're one of the most successful states when it comes to our eligible population getting vaccinated. That is amazing. However, we still have work to do. And so we just need to continue to push at it. And, as you know, Governor Inslee always says, let's work together on this. That's what we're trying to do. But we can't do it if parents don't do the right thing and get their kids vaccinated. Now, interestingly, we're actually hearing from some pediatricians that what's happening is a lot of parents who were hesitant themselves to get vaccinated, when they go and get their kids, questions answered or get their, 12 and up kids to get vaccinated, they're actually then saying, hey, I finally talked to a doctor and I'm actually going to get vaccinated as well, which is the right thing to do.
Well, that's encouraging. So what's the difference with the children's dose when it comes to getting vaccinated this time around? We understand that it would be a smaller dose potentially than the Pfizer dose that a lot of us received, and maybe even smaller needles?
Yeah, so I think the key is that one of the reasons that there was some difference in timeline of getting this 5 to 11-year-old category of kids to be approved from the FDA side, and then certainly it's going through the CDC process, et cetera, is because of this smaller dose. They wanted to make sure that the smaller dose was, one, still effective, but also safe. And they found both things, that it was effective, smaller dose, it's about a third of the adult dose, but it's also safe. And that is the key message, that look, vaccines work, they're safe, they're effective, and that's the same for 5 to 11-year-olds. So this is encouraging news, and I just want to encourage all parents, whose kids are 5 to 11 or 12 and up, get them vaccinated, because we want to keep them protected, and we certainly want to keep them in schools.
I do have to ask, I mean, we've got high vaccination. We're hearing about high vaccination rates across the state at this point, especially with the compliancy when it comes to state workers and county workers. Our state's largest county, King County, requiring vaccines to basically do anything at this point. And now we have kids able to get the vaccine. So how does this impact mask mandates? Do you see mask mandates going away soon?
Right now, I don't, because look, I think the key message is that we are just starting to see some leveling off of this incredibly high number of people getting sick and also people getting hospitalized from the Delta surge. That does not mean that we're out of the woods. In fact, if anything, we've just started to come down, but we really need to see it come down really, really far, and really to numbers that are going to be manageable, and also that are going to be safe for all community members to be able to get to a point where we're thinking about those policies being pulled back. Look, those very policies are what are helping us fight this pandemic and fight this surge. So this would be too soon for us to be doing that when it comes to masks. And certainly, I want to make sure people are avoiding crowds. We got Halloween coming up. I want to make sure that, people are doing everything they can to protect themselves, their loved ones, avoid the big gatherings, be careful when your kids are out on Halloween, make sure that they have a mask underneath, not just the mask that they're wearing for their costume, but a mask underneath. Do all the things that are going to continue to protect you and your family. And so that's why it's too soon right now to come off of these precautions, because they're safety protocols that we have enacted right now.
And speaking of gatherings, a lot of families want to get together this year and celebrate the holidays. And it is conceivable from the timeline that we understand that we could be getting shots in arms for these young kids in time for the holidays. So what would your guidance be for families that want to get together, maybe going over to grandma's house? I mean, would we be wearing masks? I mean, what kind of precautions would grandma be wanting to take to have the family over?
Yeah, I mean, it's still a little bit of ways away, but I think the first thing is to make sure everybody in that family and that gathering are vaccinated. I think that's the first thing. The second thing is that you really do need to be thinking about wearing masks and how you're going to have that gathering. Should the gathering be outdoors? Should the gathering be in a space where people are spaced out? How limited it is that people are going to be, keeping those masks down when they're eating or drinking, things of that nature. But at the same time, if people in that home are vaccinated, that gives you the best protection. So that's why it's so critical that now that we got 5 to 11-year-olds that are going to be in part of that mix, that everybody 5 to 11, 12 and up, 16, 17-year-olds, 18 and up, middle-aged people, seniors, elders, that everybody's part of that solution for vaccines, which is ultimately how we're going to protect each other even during the holidays. And I think that's the key message, is there are things we can do. So, this is one of those challenging times where everybody says, well, I'm not sure how long this is going to last, and what are the things that I can do? Well, here are the things you can do. So, take that, as they say, and I'm originally from Texas here, bull by the horn, take it and move in a direction where you can actually empower yourself and your loved ones to be protected against this horrific virus.
We can all be part of the solution that way. Dr. Umair Shah, thank you so much. Appreciate that.
Absolutely. Anytime. Be safe.
Thank you.